to start off with that. We all have to be very thankful for our lives, for our homes, for those who are protecting us, our firefighters and policemen who are protecting our homes and us. So, can we turn down the music? Can we turn down the music? So, I know it's probably hard for some people to have made this this event. So there was a huge RSVP list, and I know some people weren't able to make it because of the fires. So if you know any friends who wanted to come and they weren't able to make it, just let them know that what specials that we have tonight, we're going to extend till next week. So that's going to go until next Thursday, so that people didn't miss out because they couldn't make it. So without further ado, I'm going to go over the main talk tonight, and that's about fat transfer. This is a procedure I've been doing for a while now. Actually, this has been done for a long time, but it's actually been changing, and the evolution of fat grafting has gotten better and better with time, and that's why I want to present it, because it really truly is the best natural filler you can use. Not to kind of you know, a point or a thorn to some of our reps who are supporting us tonight on facial fillers, because they're like, well, then that's going to take business away. Yes and no, because the right candidate for a fat grafting procedure is going to be somebody who is able to take some downtime and okay with a result that's going to last a few years, versus somebody who's okay with coming in once a year with a yearly maintenance and an office visit. So there's a difference between the two procedures. So I'm going to talk about fat grafting, and that is the grand prize tonight. I don't know if everybody got to hear about that's the grand prize. I know we have some fabulous prizes tonight, and that one is worth $6,000. So I only saw 6 raffle tickets in there, and I was like, whoever wins, they've got great odds. So if you have any raffle tickets left right now, you may want to put it in that one. Okay, and then the other prizes that we have tonight, it's Botox, Dysport, Restylane, which is a hyaluronic acid filler, Juvederm, or anyone in that family. We're going to decide based on, if you win that, I'm going to decide which filler is best in the family for you. And then we have Hydrofacial. There's 3 winners in that. So if you put it in that bowl, we're actually going to draw 3 winners out of that bowl for the Hydrofacial. And then the IPL, there's going to be 2 winners from that bowl. So there's more odds for those 2 prizes. And then the last one is a skincare package from my line, which is worth $500. And so I saw just a couple raffle tickets in there too, so that one is one that you should probably put in as well, because you could probably win that. All right, so without further ado, I'm going to go about talking to you about a natural, youthful look using your own fat. All right, first thing I think I want to talk to you about is what the natural aging process looks like. We all know that as we get older, we're seeing fine lines and wrinkles on the outside. We see the outside, but we don't know what's going on in the inside. And on the inside, what's going on is that we're losing fat. We're losing volume. All right, sorry, it's just taking a little bit of, I didn't know if everybody could hear me, because this is a big space, and my voice can't carry because it's very weak. Anyways, so about aging, we do lose volume in our face, and one of the things that we lose is fat. So if you can see this picture, what happens as we get older is the volume of fat decreases, and then it descends in the face. So if you start seeing these jowls, that's what's happening. That fat's not only less, but it's also descending over in our face. The other thing that happens is we lose bone structure. So the thickness of our bone decreases, and then the muscles in our face weaken, so they thin out as well. So all that volume loss results in the wrinkles and the hollowing that we see in our face. So what can we do about it? Well, that's why fat grafting is the ideal filler. because we're losing fat already. So why not take fat from another area of our body and fill it with our own natural fat? You don't get an allergic reaction to your own fat. It's your own material. You have plenty of fat in your body elsewhere. We lose fat in our face, but we don't seem to lose it in our body. So that's a great source for it. Then you're taking like with like. You're refilling what was already lost now with fat that you're getting from somewhere else in your body. And then when we take fat from another area of our body, we are obtaining stromal fat cells, which are stem cell progenitors. So they stimulate the production of new tissue in the area. So when I take fat from your belly, this fat lives in your face, but there's also some stem cell fat cells that stimulate growth of not only the fat cells there, but your skin cells and other cells in the area. So your skin looks even slightly smoother and rejuvenated. So I'll go over that with the post-operative pictures. All right, next one I want to talk to you about, so this is the traditional technique. This is a technique that was developed about 25 to 30 years ago by a plastic surgeon by the name of Dr. Coleman. And so this is what everybody's been doing for the past 25 years. And it fell out of favor, and then it regained in favor, and then we started to introduce new techniques. So the old technique was we would take saline, tumescent saline anesthesia, inject where we were harvesting, numb the area first. Then we would suction the fat, and we'd use large cannulas, meaning the holes were very large. So you would get lobules of fat instead of really tiny fat cells. Then we would centrifuge that, just spin it down, take out the blood on the bottom and the serum and oils on the top, and we just harvest the fat. Then we would re-inject the fat. We wouldn't do anything else with the fat. We would just re-inject it, and it would be large chunks of fat. And that's why you can hear people say, oh, people say that fat grafting isn't good because you get bumps around the eyes or bumps in the cheeks. And that was because it was done in this old technique, and you could get bumpiness. And that's what people didn't like. So the free large fat lobule grafts are then transplanted. So it's a transplant, it's a graft, but it doesn't have its own blood supply. So because of that, you don't know what's gonna take. Something that has a blood supply and you transfer it to the area, 100% of it will take, 99 to 100%. But if it doesn't have its own blood supply, it's a new tissue that has to find blood supply from its host site. So because of that, you won't get 100% of it to take. And so the unpredictable nature of this old technique made it kind of hard for people to judge, and they'd have to go back in and add more fat or take out fat because there's too much that took. All right, so next slide. This is a fat section of, if we harvested the fat, you have all these little fat lobules, and in the fat lobule itself, you have the tiny fat cells. The problem with the old technique is we would take this huge fat lobule and re-inject it instead of taking them at the finest cells. So what happened was you can't get the blood supply to the center, so the center would die. So all the fat cells in the center would die, but the outside might live a little bit. So you would cause the dying of the fat cells, not all of it would take. Right? Next slide. So this is just a depiction of what a big fat lobule would look like. It has all these little cells in one big bump. So that was the problem with the Coleman technique, is the survival of free grafts is about 30, some reports, if you look at the literature, was 30%, and some as much as 80%. And so there was discrepancy as, oh, well, we could get more because of this technique, but it couldn't be repeated. And then it was inconsistent, unpredictable, and fat cannot be injected too close to the skin because they were fat lobules, they were bumpy. So if you got too close to the skin, you'd see it. So large injection volumes in the face would result in bumps. So this is why we changed our technique with time. And so this new technique that we do is micro-fat grafting. And it's really been over the last 2 to 3 years that this has come about. Really, it came about in Europe, and then we've started learning the technique. So what it means is we use smaller cannulas when we harvest the fat, so the holes are very small, it's 1 millimeter small. And then once the fat's harvested, we process it through smaller holes even, and through a mesh. So then that's why it's called micronized fat, because the mesh, the size is in microns. So not a millimeter, but less than a millimeter in terms of size. So we're harvesting the fat cells down to the very smallest cells. We don't want the large fat lobules. And then when we re-inject it, then it's easier for that fat cell to survive, because now you can get the blood cell to all the little fat cells. So those are the fat cells that we're trying to harvest and re-inject. Then the other addition that came about was platelet-rich plasma. Do you guys want to come in? There's seats here. Well, there's some space in the back. So platelet-rich plasma, what is platelet-rich plasma? Well, it's from our own blood. And in our blood, we have a high concentration of growth factors that mingle with the platelets. And so the platelets carry those growth factors. So when we try to spin the blood, we're harvesting just that platelet-rich plasma, because those growth factors contain important stimulants to help collagen be produced in our skin, to really stimulate new skin cells, and to increase vessels to nourish the fat, and that's what we want, all right? So this is a natural product for speeding up healing, in wound healing, for scars, for burns, but especially that's where we took it from. We took it from this literature, from burn literature and wound healing, as well as orthopedics, because orthopedics were using it in the knees to really heal. Instead of doing surgery, they would stimulate the healing process in the knees. And so that's where we got the literature to now combine this with our fat grafting, our microfat grafting, combining it together. So this is what a PRP looks like. We take out the blood, we just harvest the platelet-rich plasma, which is at the top, and then, next slide, that's what it looks like, that yellow serum. The most concentration is at the bottom, that is what we want to re-inject. So we combine two techniques, really. We combine microfat grafting with PRP. And some of your estheticians, I know I have some estheticians here, but some estheticians know what the beauty of PRP is, why it's helpful. But combining those two together has really increased the survival of the fat grafts. So that's what I'm doing now. And so it's a smooth natural filler. It can be injected close to the skin, because now you're not creating bumps. And so I can actually inject it into wrinkles, and I'll show you some pictures later so you can see that. And it's a more predictable grafting. So I'm going to show you a video of me doing this. This was actually my first case doing this. It's about a year and a half ago. Oh, let's get out. Yeah. And then push play. Yeah.
There's no volume.
No volume? All right. So you're just going to see me doing what I'm doing. That's the PRP in one tube, and that's the fat in the other. And I'm mixing it now. Okay. I've already processed the fat and put it through the mesh. Well, not through the mesh yet. I'm just adding PRP first, and then I'm going to put it through the mesh. So you'll see what I'm doing. That yellow serum is the PRP. I'm going to mix that a little bit. I'm struggling there. So this little thing, this connector is very small to harvest the fat and push it through smaller. We want to harvest the smaller particles, so that's what I'm doing there. So now I'm mixing the two, and it turned a milky white. I don't know if you guys can see that. So it turned the fat a little white. So it's now engulfing the fat with this PRP. It's actually very nice when it comes out. Very smooth. It's smoother than some of the fillers I use even. Okay. And then So this is where now I'm putting it through the mesh. The mesh is in here, and I'm pulling out the fat, and I'm going to start re-injecting it. So it's very nice and white. It's purified fat. Okay, keep going. This is the injection that I'm doing. Now, if anybody's grossed out by this, please look away. She is awake, so it seems like, you know, it doesn't, I know, this is something I do in the office. I don't do it this way anymore, so the technique is a little bit different. I actually do it like a filler, so I use a micro cannula. So that's like what I do for fillers. So this is the older technique. I have another one with a newer technique. Keep going. So we're gonna stop here. Yeah. Okay. All right, you can come out.
Sorry.
Yeah, keep moving. Okay, so now we're gonna go to the next slide. So I wanna show you my before and after photos, because you're like, well, does this work? I mean, what does it look like?
Pretty impressive.
So I want you to see like around the eyes, underneath the eyes. Because the problem I have with fillers under the eyes is it's not so smooth. It can look like there's a ridge if you overdo it. Because Restylane is our gold standard, and it's still a little bit rigid. So if you could see under her eyes, even her fine lines and wrinkles got better. Okay, that's where we did it. We also did it here and in the chin. So you'll see in the next few pictures, that was her chin. So we also gave her, like, instead of doing a chin implant, we just put fat there. Okay? So this is another patient of mine. We did, if you could see the texture and tone of the skin, as well as volume in the cheeks. So it pulled the cheeks forward a little bit. And then I'll show you another picture where we show just the eyes. So this is just the eye area. She had hollowing under the eyes. You can see a little bit of discoloration there too. And now that's filled out and smoothed out. And we also did in the cheeks, so you can see that as well. Okay? These are subtle. These are sort of the results you would get with a filler. But with a filler around the eyes, I get problems because it can look too rigid and look obvious. So with fat, it's natural. It's what is in your face, should be in your face. So that's why it looks all smooth. Now this, going back, I did it for the wrinkles. So you can see these deeper lines got smoother, and that is why I could use fat there. Because now I'm harvesting in such small size that I can inject it within the wrinkles, where we couldn't do that before with fat grafting. Next slide. Another one, this is what I love to use around the eyes. Fat grafting is perfect for around the eyes, and it is a very natural filler. So there you have it. Next slide. So this is my conclusion. I just want to let you know this is a more predictable graft take. It can be injected in thin skin areas around the eyes. Faster healing times. I could do this on a Friday and you would be back to work on Wednesday. Some people will take a little bit longer. Friday, it just depends on how you heal. If you do get bruising, then it'll be longer. It requires less volume. I usually use a cannula, so I use a 25 gauge micro cannula. So that's the same thing that I use for fillers. It's blunt tipped, so it's not going to be sharp, and it's it's a plastic cannula. So it's not going to jab you like what you were seeing there earlier that was like the steel cannula. And it can be done under minor sedation in the office. Patients are comfortable with this. And the downtime is it can be 7 to 10 days, or it could be less than that even. And the results last 5 to 10 years. All right? Okay, so if you haven't put it in that prize yet, I should see all of you mad dashing. All right, any questions?
Where's the fat? Where do you get the fat from?
We can take it from anywhere. Ideally the belly, because then I don't have to move you around to get it. So you're lying on your back and I get it from your belly. We can get it on the inner thighs and the outer thighs. Those are the other areas. Yes?
How do you know you have the stem cells with the fat when you inject it and after you manipulate it for a while?
We don't know. We can
Oh.
assume that we're
Right.
harvesting. Because this is the same graft material that's used for orthopedic cases that they're using for the knees. So we're using the stromal fat cells that have a stem cell potential. So yes, that's what we're doing. We're doing the same sort of technique, but we're doing it for the face. Yeah. Any other questions?
Impressive.
So now we're going to be doing some demos. We're gonna be doing a Botox demo, and we're gonna be doing some filler demos. So if you wanna be watching, I'll be doing an injection for balloon in the cheeks. And Botox, I think is gonna